My name is Joshua Owolabi, and this presentation is entitled Proposing a Framework Guide for the Integration of Educational Technologies and Innovations into the Teaching of Anatomy and Medical Sciences, the ASIC Framework. Educational technologies are becoming important and integral to medical education, arguably more than ever before. The scope and appreciation for digital medicine is also widening, not thanks to COVID-19 induced restrictions that has influenced the delivery of medical education globally. Technology has now become a major avenue to sustain medical education and practice. However, there is observed heterogeneity in the deployment of technologies and educational innovations. There is currently no generally acceptable framework. Various types of technologies are being used. These include hardware technologies, software, virtual realities, simulation, augmented reality facilities, as well as the use of customized 3D printed materials, amongst others. The current framework, the ASIC Framework, attempts to provide a framework that will work for various medical education systems, and it is centered around four key considerations as follows: adaptation, standardization, integration, and compliance. In this article and presentation, the ASIC framework is being presented, illustrated, and discussed. The first consideration is adaptation. Innovation and technology should be suitably adapted to program designs and institutional systems for optimal performance and best outcomes. Standardization. Clearly determining the purpose that innovations and technologies do serve, the objectives they meet, and supporting their use with evidence for best and standard practices. When it comes to integration, this involves creating a place for the use of educational innovation and technology and aligning the use with other components of the education system for optimal performance. Hybrid compliance. Evidence of compliance with institutional standards, program requirements, and regulations of relevant bodies should be addressed. This diagram shows the key consideration of this framework: adaptation, standardization, integration, and compliance. It also shows that these should be aligned with learning in the primary domains of knowledge, skill, and attitude. It's important to give consideration to the program design and consider competencies as milestones. There is always an integration center, classroom, hospital ward, for example, laboratory, or the field. This should provide an opportunity to align this concept with other aspects of medical education and training. Having said this, why is this framework important? It is built on learning theories. Number two, it allows and supports the introduction of new technologies into medical education. Number three, it considers very important factors, including adaptation, standardization, integration, and compliance. Number four, it addresses competencies as milestones. Very importantly, it addresses learning in all primary domains of cognitive, psychomotor, and affective. Thank you.